So, how has been our day?
Fine, we thank God.
All right. You're welcome to today's online facilitation. And today we will be proceeding to Unit 4 of NSC 303, right? Yesterday I posted the PowerPoint instructional video. I posted it both on the school link page, and on our WhatsApp group. I hope we're all able to access and read and listen to the instructional video. Let me assume that we are able to go through it in addition to our course material. So we are going to have a quiz and an assignment. So the assignment will be posted to the school page before the end of the 8 weeks facilitation. And the quiz also can come, since it's quiz, it will be unannounced. So I will come to class and I will just post my question, and it's going to be recorded. It's going to be part of our CA. And let's also bear in mind that we will need one Sunday for extra class that we miss. So let's proceed to the class, to the topic of today. And unit 4 is titled Organization Health System in PAC, State and Federal. That is the topic, Organization of Health System based on PAC. And like you always know that before we dive deep into the discussion for the topic, we normally share the learning goal or the learning objectives for the course, or I mean for the unit. And so for this unit, basically we have 4 learning objectives or learning goals for unit 4. And what are they? At the end of today's discussions, learners should be able to define health system, list the characteristics of health system, describe the organizational structure of health system at federal, state, and local level of our health system. And lastly, learners should be able to explain the roles and organizations of National Primary Healthcare Development Agency. So, I'm in class. I'm in class. So the floor is open now based on the course materials that you have gone through and the instructional video that was earlier posted this week. I would like any of you to share with me what you understand by health system organization. So what do you understand by organization of healthcare system? What is involved in organization of healthcare system? You're welcome to share your thoughts. Don't forget, I always tell you that the more you involve yourself in class, the more you participate in the facilitation, the better for you. And don't think that attendance is just by mere presence. For you to get the whole mark of attendance, you need to be participating in class. So what do you understand by health system? What do you understand by health system? When someone asks you, how would you define health system? I'm listening. Who wants to share his or her thoughts on that topic?
Hello?
Yeah. Jonathan?
Yes, ma'am.
All right, you're welcome. You may
I
proceed.
Okay, I want to share my thoughts on the healthcare system. Though I have not been able to go through the slide. This is my first time in class because of work schedule. So to my own understanding, when we talk of healthcare system, it's talking about these different sectors that comprises of the healthcare system, which is we start from primary healthcare to the secondary and then the tertiary healthcare system. When we talk of the primary healthcare system, they deal with the preventive measures.
Okay.
That is the primary care. That is the primary healthcare system, and then that is the sector that has to do with diagnosis, treatment. That is when we have gone past the preventive sector, we move to the diagnostics measures. Then when we talk of the tertiary healthcare system, that is like the referral centers, the rehabilitation centers. That is like we have university hospitals, that is teaching hospitals. Those are the tertiary healthcare systems. Thank you, ma'am.
All right, thank you for the trial. Thank you for trying. Yeah, Ioma. Yeah, you may unmute yourself and speak. Let's hear your thoughts.
My own thoughts on health system organization is just a constitution of many people or many sectors that involves in management and then involves in matters related to health.
Okay, okay.
There's so many divisions for me. So
Okay.
from there, we can go on just the definition.
Okay. So having said that, from that word organization, we know that it's involved a lot of sectors that comes together to form an organization. So how would you define health system itself? How would you define health system? Who wants to try? Who wants to try?
Yes.
Okay, you go ahead, please.
I said the health system is a system that consists of organization that involves in health matters of the community or the state and the federal government, federal sector.
Okay, good try. Good try. Yeah. Hioma, were you able to go through your course material on this unit or listen to the instructional video for this unit?
No, ma'am.
Not yet. Okay. I will encourage that you please, even if you can't go through the course material because of the volume, try. The link was posted to our WhatsApp group. Please kindly check it. Check it and go through it. It will really help, okay?
Okay.
So
Thank you.
basically, health system is defined as a coherent whole of many interrelated components, both the sectoral and the intersectoral, as well as community itself. So, and this community that we are talking about produces a combined effect on the health of the population. And it can be the health system, can be in the context of the PAC, can be in the context of the federal, can be also in the context of the state. Like we know that we have 3 tiers of health system. When we talk of the federal, the state, and the local, which we would get to as we proceed into this class. Okay, so we've seen that is a whole of many interrelated components, both sectoral and intersectoral, which we'll understand that time as we continue, what we mean by sectoral and what we mean by intersectoral. And all these things have effects, on the health of the community or the population. And also for us to understand more the components, the interrelated components of health system, we want to look at 3 basic components of health system. What are they? Who wants to share with us? What are the 3 main components of health system? Who wants to try?
The 3 main components of health system.
Okay.
Yes. Hello. Hello.
Yes. Yeah. We can hear you. Please continue.
1 is the Federal Ministry of Health.
Okay.
The State Ministry of Health, and then the community health sector, that is the local government sector, Ministry of Health. So
Okay.
that's it.
Okay. Okay. But in this component, in this stage now, we are looking at the component of health system concept. Maybe because I didn't put that word there. So, and we have basically their concepts. When we say the concept of health system, it's basically the health and the disease. That's an example of a concept. And the second component part is the idea. What is the idea behind the health system? Is to give health coverage, effective, efficient, and impact to the population. And we have the objects. What are the objects? You have the hospital itself, you have the health center, you have the health programs. And lastly is the person, that is both the consumer and the provider. So basically the 3 component concepts of health system is ideas, objects, and persons. Please kindly take note of that. And you must understand that the ideas, what does it mean? What does the object stands for? And what does the person stands for? So in case you come across likely question like that, to list with examples the 3 concepts of health system. Is different from the 3 components of health system, or the 3 levels of health system. When I say the 3 levels of health system, is when you should mention the federal, the state, and the local government. But when I ask, or when a question asks for the 3 concepts of health system, basically you should be talking about the ideas, the objects, and the person, okay? And it is important that these three components, these three concepts that makes the component of health system interact together to support one another. Of course, if you have an hospital and there is no person, which is both the consumer and the provider, the healthcare provider, the hospital becomes useless. So you can see, and if you have the person, if you have the health personnel and there is no manpower, it's equally not going to be effective. So the whole concepts are interrelated. And of all these three component concepts, we will see that the object and the person, the object and the person, it's very, very, very essential because of what? It's aimed at delivering the health service to the beneficiaries. Okay.
Hello.
Hello.
Okay.
Hello. Hello, can we get the examples of the ideas, objects, and persons?
Did you manage to download the instructional video?
I did not download it.
Okay.
But from your lecture now, we can get it that person is examples of person, then object, ideas.
Example of person, like I mentioned, is the healthcare providers and the consumers.
Okay.
And the examples of objects is the hospital, the health centers, the health programs. Okay.
Okay.
And
that
the
of the idea.
examples of ideas is equity, coverage, effectiveness, efficiency, and impact. I will still encourage you as much as possible to please go ahead and download the instructional video. All the details are there with explanation. Okay.
Okay. But what of our textbooks? The material we are
The
given.
course material.
Yes, the course material.
They
All
are
these
there.
things it is not there.
They are there. They are there. They are
Okay.
there. Yes. They are there. Check under Unit 4. Everything I'm covering with you is in your course material. The instructional video is to simplify it for you. That is why, because it's both audio and letter. Okay. So it's not just reading. As you are reading it, you are hearing my voice from it. Okay, explaining each of the paragraph or each of the slides. That is why the instructional video is complementary, is complementing your course material. So you do yourself a lot of good when you listen to instructional video as well as read your course material. Okay. So I encourage you to do that because your exam question is not going to come outside of these three areas. Your exams will come from your course material, the instructional video, and the facilitation. Okay. All right. Alimat, you're welcome to share. Let's hear your thoughts. Please, ma'am, I'm not seeing your slide. I'm not sharing slides. I'm not, Salam, I'm not sharing slide. If I want to share slide, I will tell you that I want to share slide. If there is need for me to share slide, I will tell you and I will share the slide, okay? So whatever we are discussing now is been posted earlier. And like I said from day one, that this is a student-centered learning. You are to talk back to me today. That is why I sent the instructional PowerPoint video at least 48 hours, between 24 to 48 hours before our facilitation, to give you an ample time for you to listen to it. It's not just what you read, and it's not a lot of slides. It's 11 minutes. I think maximum, yeah, that should be maximum, 11 minutes, which at your break time in your office, you could listen to it. Yeah, you could just read those few slides, which should enable you or prepare you for the class today. So please, I'm begging you, kindly endeavor before our online meeting class, endeavor to go through the through the PowerPoint instructional video, go through your course material. You already know, because each week I'll tell you, okay, this is unit 3, this is unit 4. Automatically, if we are doing unit 4 today, you should know by next week when we meet, it will be unit 5. So you are not ignorant of what will be covered the following week. All right, Alima Abdullahi, you can unmute yourself and let's hear your thoughts. I can see your electronic end and you are not speaking. Okay, perhaps she's struggling with network, so hopefully she would connect with us later. All right, so as I was saying that yes, so at this we'll move to essential characteristics of health system, and I want us to share with me what are the essential characteristics of health system. Who wants to try? List the essential characteristics of health system.
Okay.
Who wants to try to share with us characteristics of health system? Who wants to try? Okay. Since I'm
Hello.
not getting any volunteer, please, someone should add me to the WhatsApp group here. Okay, it's taking note, it's noted. Jonathan, you'll be added to the WhatsApp group. But meanwhile, we don't need to add you. You can click on the link. We've already posted the link on the school page. Just go to the school page for this course. Click on this course. The link to join the WhatsApp meeting is there. Please kindly join via that link, okay? Yeah, I've made it simple for you guys. I've posted the link there. Please access the school page, go to this course, then you can join via the link that is shared there. So let me share my slides with you on the characteristics of health system. On the slide, as you can see, we have the following characteristics of health systems based on primary health care. The system should be encompass the entire population on the basis of equality and responsibility. And another point is it should include components from the health sectors and from the other sectors. When we say other sectors, remember when we were defining health system, we said it's a whole of many component parts, sector and intersector. So, and I told you that as we progress into the course, into the topic, you will understand what we mean by sector and intersector, sectoral factors. So, what are these interrelated actions contribute to health? For instance, educational sector, public works, animal husbandry, and agricultural sectors. These are sectors that you cannot rule them out when it comes to primary health care because they play a vital role for the health system at that level. I am. If you are not sharing, can you kindly please? Okay. So the next characteristics of health system will be that health is a subject of overall socioeconomic factor of the community. What do we mean by overall socioeconomic mileage? Because you can't, in a situation whereby, in a situation where the community is not empowered, then there will be problem. There will be problem. There will be problem. So those are basically three characteristics of health system. Any question? Okay, if there is no question, another point that I want us to look at is the primary health care itself. Remember in Unit 2, we discussed the definition, the components or the elements of PAC. And at this time, we want to look at the intermediate level, more complex problems that should be dealt with. It is essential for us to understand that a better trained personnel or staff should be employed or should be provided at the PAC level. And not only that, you should have a supervisory staff. So apart from the general staff that should be employed at the PAC, there should be a superior, a manager, who will supervise all other staff and ensure that there is a continuous training, education of workers, that is an in-service training. You can't say because you employed someone this year, automatically that person do not need to upgrade. There is need to upgrade. There is need to increase in skills and knowledge. And it's all the skills and the training is very very essential to guide the public of different communities and health workers on practical problems arising in connection with all the aspects of health care. What are the central level? We have structural organization of health system. So earlier on, someone mentioned the federal, the states, and the local. This is where that answer is relevant now. How many structural organization of health system do we have? You can see that the question is different. So basically in Nigeria, how many do we have? I need
3.
someone to share. 3. What are those? What are they, I mean?
Okay, federal level, state level, and local government level.
Excellent, excellent. So each of these structural organizations, we are going to look at their role. What do they do? Okay. So when you see question like this in an exam that says concept, the 3 concepts of health system, what are they? What are the 3 concepts? You said?
Idea, object, and person.
Excellent. Excellent. So you can differentiate now that the concept of health system component is different from the structural organization of health system. Please be clear on that and don't mix them up. So,
Good afternoon.
Good afternoon. So let's look at each of these structural organizations one after the other and unpack them. Organization at federal level. What do they do? And what do they comprise? What does federal level organization comprise of? Who wants to try? Who wants to try? Hello, class.
Yes, ma. Let me come in again.
All right.
It composes of Federal Ministry of Health and the National Council on Health.
Okay. So you said, please, when such a question comes, always be complete. See, many at times students miss mark because they give half information. You said the federal and the national council. So as much as federal is there, but it's incomplete. It is Federal Ministry of Health and the National Council of Health. Those are the two federal level components, if I may put it that way. So the next question that I'll ask is, what is the function of each of these organization? At Federal Ministry of Health, what is their role? At National Council of Health, what is their role? Open tests or open what would I call it now? Who wants to share with us? the function of Federal Ministry of Health. What do they do? Who appoints a minister? Okay, I can see Halima, you've been raising your hand that we've given you audience since. You may speak, Halima. Okay.
Good evening.
Good evening. Good evening. Let's hear your thoughts on the function of Federal Ministry of Health.
Mama, I'm just coming in. I didn't raise up my hand.
Oh, your electronic hands has been raised. All right, it's fine then.
Okay, thank you.
Ioma, let's hear your thoughts on that. Ioma, Victoria.
Hello.
Yes. Let's hear your thoughts.
The functions of the Federal Ministry of Health, it is that justified. One is that policy making. They are the people or the department that makes the national policy on health, and which will be adopted by the federal government.
Okay.
Number two is that, yes, then they make sure that the health policy is being implemented by the federal government and state government, even to the local government.
Okay.
Then the approval for this the policy will be submitted to the federal government. And then if there is any financial plan for the whole year, they are the people that will make the budget and give it to the federal government for them to sign. Or if there is any law on health, they are the people that will give it to the federal government to sign into law so that it comes to play.
Okay. Is it
In other words, they can coordinate other health sectors, including the state, the federal government, even the FMC, Federal Ministry of Health, State Ministry of Health, even to the health centers. They have the capacity of coordinating the activities.
Okay.
Thank you.
Thank you very much. That's a brilliant contribution. Yeah, of course, federal control the states and the local governments. One quick question. Is the Minister of Health, is it a political appointment or what?
Yes, it is usually
Political appointment.
Yes, it is usually political appointment.
Okay. Okay. Yeah, it's important to know that. And we know that the Federal Ministry of Health has 5 directorate departments. That is, there is 5 departments under the Ministry of Health, which you have mentioned. The Department of Personnel Management,
They use
the Department of Finance and Supply, the Department of Planning, Research and Statistics, the Department of Hospital Services, and lastly, the Department of Primary Health Care and Disease Control. Very, very important to take note, okay? So we move.
Go back again, let's put it down. The department.
Ioma,
yes.
I will encourage that after this class, you should get the instructional video. You will get the details there, okay? This 1 hour is just for facilitation. You can't get all the points. That is why I said at the beginning of this class that it is important for us to attend class because it's more, it expatiates more. But to get the full notes, it's contained in the instructional PowerPoint video and the course material. Okay, so when you now go back to the instructional video or your course material, it makes more sense to you because you participated in class. Okay.
Okay.
Yeah.
Okay.
So it's not hard
Okay.
at all. It's 11 minutes video. Sometimes you even get some of the units, you get like 8 minutes. And I've made it much easier by posting it on the WhatsApp group. Are you on our WhatsApp group for this course?
Yes, yes.
Yeah, so it's there. Just click. I tag it instructional video for unit 4. Click on it. Then you will see it. Then you can take your time, form your note around it. Okay?
Okay.
Yeah.
Thank you.
Yeah. Just take note of those points that we have 5 departments under Ministry of Health.
Yes.
So when you now read it, then you know and you take note of that. So the responsibility of Federal Ministry of Health, what are they?
They
Who
define
wants to
standards of
try?
practice.
Who wants to try? Yes, please go ahead.
They define the standard of practice in the health sector of the nation.
They do what?
They give definition, they define standard of practice.
Okay, okay.
And they are responsible for review of national health policy.
Okay, okay.
They also take part in legislation for health.
Okay.
Yes, ma'am.
Okay. Yeah, thank you very much. In addition to that.
In addition to that, let me continue from there, ma'am.
All right.
They also allocate federal resources.
Okay.
And also, they also monitor the statistics of all the health institutions like the state, the primary healthcare in the state, in the local government areas.
Good.
They also coordinate authority in all health works in the country.
Okay.
I think that is what I remember now.
Okay, thank you very much. Thank you very much for that contribution. You are all right. Who else wants to add to the points that have been mentioned, the points that have been mentioned on the responsibility of the Federal Ministry of Health?
They promote and inform public opinion on matters of health.
Excellent. Excellent. Yeah. Who issues guidelines and principles to help states prepare and manage programs and services?
Federal Ministry of
Federal
Health.
Ministry of Health.
Federal Ministry of Health, yes. So those, what you have mentioned so far are the responsibility of Federal Ministry of Health, and the points you actually mentioned are very correct. So, and in addition to that, we have other point, which is they also monitor and evaluate the implementation of this national policy. When they make a policy, they have to do monitoring, they have to evaluate it. Are we achieving our goal? Are we achieving the objective that we set? So those are also the things, and they report. They also give report on findings. Not only that, they promote research that is relevant to the implementation of the national health policy and the state's health strategies. Not only that, they define standard, what and how things should be done in terms of health system. They define it with respect to delivery of health service care. And not only that, they also monitor it, or it is their responsibility to monitor it. Let me better put it that way. It is the responsibility of the Federal Ministry of Health to monitor, to set a standard of healthcare delivery, monitor it, and ensure compliance from the healthcare providers as well as the consumer. So, and not only that, provide health technology, including equipment, supply drugs, and so on and so forth. So far, those are the responsibilities of healthcare system. We also have international health.
Ma,
Yes.
excuse me. Can we also say the epidemiological surveillance of health-related issues in all the states and local government, are they the one that also oversee what is going on in terms of the surveillance of diseases?
The federal, don't forget that the local government, which is the PAC, report to the state report to the federal government. That is how it works.
Yeah. Okay.
Peter,
Okay.
am I right?
No, it's Irabo, Philomena Irabo that is talking.
Yes, I know.
You are right,
I'm confirming from one of your
You are right.
colleagues. Yeah.
Okay.
So that's how it operates, because it's an hierarchy.
Okay.
Okay.
Thank you.
You're welcome. So as I was saying, that now don't forget that what we just covered now is on federal Ministry of Health. And don't forget that we said that there are two functions. Okay. Earlier on, we said that we have two level, the federal level consists of two
organizations.
Which is the Federal Ministry of Health and what?
National Council of Health. The National Council of Health.
Yes. So we've just dealt with the Federal Ministry of Health. The next point we'll look at now is
the
what?
National Council of Health.
The National
Council of Health.
Excellent.
Council of Health.
Yes. So when we say the National Council of Health, what does it entail? What does it entail? What does the national, what is their, what do they do?
Hello.
Yes.
The National Council of the National Council of Health, they composed of the following members: the Honorable Minister of Health, the Honorable Commissioner of Health. So they constitute of national body.
They consist of honorable commissioners for health. So basically, there are how many?
There are two.
There are two. Yeah, and the federal also is two. So don't forget, don't forget that the Federal Ministry of Health also is 5.
Yes, it's 5. Then the National Council is 2.
It's true, yes. So it's very important to note that. And we have functions of National Council of Health. What are they?
Function.
One, they help in the development of national guidelines.
Okay.
Then the
Don't
implementation
forget.
and administration.
Okay,
policy.
continue.
They help in the implementation and then
Okay.
administration of the national health. They are the one that
Policy.
implement it, and then yes.
Okay.
Then various technical matters of the organization, delivery, and distribution of health services. They help in the distribution of various services of health services.
Okay. Okay. So basically, that is how the operation goes. One formulates, one else in the implementation. So at the Federal Ministry of Health, they formulate, part of their function is to formulate this policy. But when it comes to implementation, the national does the National Council of Health ensure the implementation. However, there is a monitoring that goes on. Okay. So we also have technical committee. When we say technical committee of National Council of Health, they compose of 5. What are they?
The federal and state permanent secretaries
Okay.
of Ministry of Health, the directors of Ministry of Health,
Okay.
the professional health in the state Ministry of Health, a representative of Armed Force Medical Services,
Okay.
and the director of health services, Federal Capital Territory, Abuja.
Okay. Yeah, you are correct. Those are technical committee that are involved in National Council of Health. Okay. So who are the expert panel?
The technical committee. One, the expert panels are one, the agriculture, rural development and water resources.
Okay.
The education.
Okay.
Science and technology.
Okay.
The labor. Social
Okay.
development, youth and sports.
Okay.
Works and housing.
Okay.
National planning, finance, health-related studies.
Okay. So basically, those are the
expert panels.
Expert panel. It stops at the finance because under the technical committee, we basically have 8.
Yes.
We have 8. The expert panel comprises of 2, which is the technical committee and health-related bodies. So the health bodies now comprise of the National Institute of Medical Research, medical schools, schools of allied health professionals and non-governmental organizations, professional associations like what we have, NMA, NAN, NNM, PSN, among others. Okay. Please,
yes.
it's important to note that basically we have 2 groups or two panels of experts, the technical committee and the health-related committee. And each of these panels has a function or a group or a sector that comprises of them, that makes this group, this panel, these experts a technical committee, and makes this one health-related body. Are we clear?
Yes.
Okay. The next
So
that
many,
would,
so many subheadings, so it's
you
not
said,
easy to remember. I said so many subheadings and headings.
yes.
It will be difficult anyway. With God, we can do it.
Yeah, you can do it. So, and that is the essence of the facilitation. By the time you sit down to read the materials by yourself, it may be a bit confusing. If you had read the course material and you've listened to an instructional video and you come to class, imagine how clearer it will be for you. Here you get. So now when you go back to the instructional video and your course material, haven't attended the facilitation class, you see, it's more clearer to you because now I'm breaking it down for you. Okay.
Yes.
Okay. And don't forget,
Yes.
you are welcome to ask even questions outside this 1 hour session. That is why we created that WhatsApp group. Ask questions on areas that need clarification and it to be addressed. So we have the state level now. When we say state level, how many states do we have under the Federal Capital Territory?
We have 36 states and then federal capital territory, Abuja, making
Okay.
it.
Okay. So, excuse me. And when we say State Ministry of Health Organization, under State Ministry of Health Organization, let me check something.
Where we get the Honorable Commissioner of Health.
So, under state, basically, we have the Minister of Health. Why in some states, they call them Health Management Board. They also participate in the management. So, and now we want to look at the State Ministry of Health Organization. How is the state level organized? Who head the health ministry at the state level? What are they called?
The Honorable Commissioner for Health, who is a political
Okay.
appointee.
Okay. Okay.
Followed by the permanent secretary in the same Ministry of Health.
Excellent. Excellent. Yeah.
Thereby have various directorates.
Okay. Okay.
The health services management board, also board as the states wishes to be named.
Yeah. We have directors that manage each of these each department. We call them directorates. So they are associated by either deputy or assistant directors. Yes. What are their functions? Functions of the State Ministry of Health.
One, ensuring political.
I'm sure it's not
commitment.
only a human that is in class. Why are others not participating efficiently? Okay. Continue.
The State Ministry of Health, they direct and coordinate authority on health work within the state. Just
Okay.
their work is within the state, they coordinate and direct the works within the state. On that, through this means, because for them to coordinate, they have to use several units.
Okay.
One is that they ensure political commitment.
Okay.
Everybody, the politicians has to be committed to health. Then ensuring economic support. From
Okay.
there, the economic support of the states. Then about the professional groups, they win over professional groups.
Okay.
The nurses, doctors, and pharmacists, they win over them and controls them, establishing a managerial process. Then they give public information and then education. They are involved in the education of the state. If it involves health, like in School of Nursing, School of Health, they are solely the coordinators. Then other in the communities, they help to coordinate primary health in the communities. Then they they give statistics of health of the state to the federal government.
Okay.
Thank you.
Thank you. Can someone else share with us functions of the State Ministry of Health?
They ensure domestication of national health policy to the state and local government levels.
Okay.
They go about issue of logistics too.
Uh-huh.
They monitor and evaluate data coming from the local government level through the health system management information, health system management information system.
Okay.
And they also monitor the activities going around as far as health policies are concerned in the state.
Okay.
They coordinate and regulate health activities in the state and down to the local governments.
Okay. What about employment or recruitment of personnel?
They do.
Who does that?
They do that.
I thought it's federal that employ for the states.
No, the federal employs for federal, states employs for state.
Oh, okay. 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 All right. So basically, we've just covered the second structural organization of health system, and the last structural organization is the local level. Yeah. And basically, as you can see, that we have 774 local government areas in Nigeria with various health facilities operating under the hints of primary health care. True or false?
True.
True. So we'll also quickly look at
their functions.
And at local government level, who heads them? Chairman,
the local
right?
government chairman. Yes.
Yes, the local government chairman.
The executive chairman, no.
You said?
The executive chairman, so that we will not remove some of the titles.
I'm not getting you.
No, you want to put the executive.
Okay, okay.
The executive chairman.
Okay,
thank you.
Okay, we've added to it to executive chairman.
Yes. And then there are his council members too.
Yes, yes. We also have council members, yes. And not only that.
They are the honorable council members.
Yes, honorable. Thank you for putting that word, honorable council members. And we also have supervisory councillors too. Yeah. Right?
Yes, yes.
Yes. Yes. So we have all these people, and they are the ones that should be working tirelessly to ensure effective and efficient running of our healthcare system at the primary healthcare level. We can pray, and let's pray for them that they will be more efficient.
And so,
what are their functions? The functions of local governments structural duty.
Their functions: one, they provide and maintain all the essential elements of primary health care.
Okay.
like the environmental sanitation and health education.
Good.
They help provide and maintain their
Mm.
essential elements.
Yeah. They also design and implement strategies to discharge the responsibility assigned to them under Constitution, because under Constitution, they have their own responsibility as well. Mm. And what are those responsibilities? To meet the health needs of the local community under the general guidance. Also to support and technical supervision of states ministries. So not only that, what else do they do?
They motivate the community
Okay.
for support.
Yes.
For support.
Yes. Excellent. They motivate the community for support. So basically, we've seen that the local strategy for health activities that is examined as this illustration that we have just mentioned provides us with an overview of healthcare delivery system at the 3 levels. So which are the primary, the secondary, and the tertiary, otherwise known as what?
The local
Otherwise
strategy.
known as what? You know it.
Come again.
Federal.
Come again.
So I was saying that
Mm.
I was saying that the healthcare delivery system are 3 levels of healthcare.
Okay.
Are
Yeah.
primary, secondary, and tertiary level, otherwise known as what? What else can we call them if we don't want to use primary, secondary, and tertiary? What else can we call them? We call them federal, state, and local level.
Levels. Okay.
Okay?
Okay.
Yeah. The primary will be the PAC, which is the local level. The secondary will be the state, and the tertiary will be the federal level. Okay.
Yes.
So don't. What do you want to say?
I'm saying teaching or specialized hospital where they carry out special care that cannot be done in a primary and secondary level.
Yes. You know, each of these level actually has their vital role. Each of the level has their vital role. And the good thing is, if the local level is efficient and effective, you will see that there won't be much burden on the state level. And if the state level also is efficient and very effective with all the necessary equipment and manpower in place, there won't be heavy burden on the tertiary level, which is the teaching hospital. Okay, so these 3 levels work hand in hand to help each other. And that is why in the hierarchy, at federal level, you can, that is at the tertiary level, you can refer a patient or a client to the grassroots. And at the same time, at grassroots, you can refer patient or client to the tertiary level. Yes. Okay, someone. Sorry about that, Jonathan. You are having network issue from your end. So is there question or further additional contribution before we end the class?
Good evening, ma'am.
Good evening.
Yeah, this is Muhammad. I have question, though I've been fully participating, though I was listening, but from some definition and explanation. Please, I want to know briefly this difference between Federal Ministry of Health and the National Council of Health. Because while I was listening, some people were, to me, it sounds like they are doing the same, the function are almost similar. So I want to know what is their differences.
Momo, thank you for asking the question. I understand today is your first time in class. If I may ask, do you have the course material? Have you downloaded them?
Yes, and again, this is not my first time. It's just that I was not in last class, but since the inception, I think I've been part of the class.
Oh, okay. Sorry about that. Okay.
No problem.
And the instructional video, were you able to listen to it?
Actually, I don't think I've been able to. Even the material, just sometimes good to schedule these days. I only emphasize on this facilitation because I'm always busy. Sorry.
This facilitation is not enough to take you through the exam.
Yes.
I must tell you.
Yes.
So
yes,
your
for
question now, let me refer you back to the instructional video. Then if you still have if you still have this same confusion around the Federal Ministry of Health and the National Council of Health, then you can post the question again on the WhatsApp group. Okay? Because they do not have the same role, they do not have the same function, although they complement themselves. Don't forget that at the Federal Ministry of Health, they have 5 components. Why at the National Council of Health, they only have 2? So they are not having the same role. So I will encourage you to please kindly go to the instructional video, listen to it. I think it's about 9 to 11 minutes. Listen to it and read that aspect. If it's still not clear, post the question on WhatsApp, then I will address it. Is it fine?
Yeah, yes.
All right. So, guys, this is where we'll end it today. If there is no question or contribution, Alima and Abdullah, I've been seeing your end and I've acknowledged you. You may please proceed with your question or your contribution.
Hello, ma'am.
Okay.
Please, about the link, some people are complaining that they will find it very difficult to log in. I don't this because many people I think they are saying they are missing the lecture. I don't know if the problem is from the link or where.
Well, the same link that they have is the same link you also use. So I wouldn't know what is the challenge.
Ma, good evening.
Good evening, Alima.
My own is that I want to ask who is to add me on the WhatsApp group.
Okay, the WhatsApp link is posted on this course page. So just go to the course page. I have put the link there. Just click on the link, you would find yourself in the group.
Okay,
okay. You're welcome. So please, as many people that are finding it hard to join the class, please kindly post the link, the WhatsApp link to them. Let them join the WhatsApp link, because every week I post the link for the class. So I share the one you have with them, the one you are using to join. Please share with them and let's know where the problem lies.
Ma,
okay.
Excuse me,
okay.
ma. Is it the same link we use every week, and is it the same date every Thursday?
Yes, it's the
Thank
same
you,
link. It's the same link. It's a recurrent link. So you can share it. I'm not changing anything. It's one link from week 1 to week 8.
Okay, ma. Thank
The
you.
only time that I will change a link is when I'm having extra class with you, which I will
Okay.
announce it and post it on the WhatsApp group.
Okay. Thank you, ma.
So share the link among your colleagues. Since you have managed to join, share the link.
Thank you, ma.
Any other question? Thank you, Peter. Was finding it very difficult to join the class until today. Sorry about that, Lilia. So this is where we are going to end it for today. I'll see you next week, God willing, same time. God bless. Have a good evening. Bye.
Thank you for the lectures, ma. Thank you.